advanced stage. So if you think about it, this person would present like a little bit of stiffness, no affect, really hard time, even with the walker, bumps into everything. Sit to stand would be like over and over.
Those are your acting tips. Those are your
Yeah, that's your cue, George.
inspiration.
Yeah.
This is from my acting career.
Alright, so yeah, so do you want me to read the case? It's Parkinson's, advanced stage. He's got, but he does have a walker, so he's able to walk. He's got 3 out of 5 strength throughout and a fair dynamic balance. He has got that flex posture, the fascinating gait. He has frequent upper respiratory infections, and he just had pneumonia. So so the first thing that we're going to do to improve posture, because he's like this, is we're going to do that PNF this way. So we're going to go get that cross center and get this up to get his pec stretched out, his intercostals stretched out up here, and push his posture back that way. So look up, Jorge. Good, and then we're coming back down this way, and then up again. Very good. Make sure you're looking up when the arms go up. Good job.
So Meg, can I challenge you that if he has a little rigidity, do you think he's going to move so quickly?
No, he's not.
Alright, so make believe like, George, you have a little bit of rigidity.
Okay.
There you go.
So also the slower movement is going to kind of help relax him. And if it's like very rigid and you're not able, you could probably just do one at a time and even slow and really push up and like give him some approximation, some feedback there.
But you would be doing a lot of it, right? You would be doing most of it.
Yes.
Okay, so
Yes.
then show us, because you're, like, make believe, like, go ahead, really, really add that stiffness. There you go.
Good. Okay. Take a deep breath out when we open that.
And pull, 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 pull. Remember the music? You need to add a little bit of music. Up, down. Like, I don't care what you sing, but.
And down. Whoa, 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 whoa. And up.
There you go.
And down. All right, so we would do that. Probably go both sides. And then we would also work on some lower trunk rotation. So because he just had pneumonia, I'd probably put him in semi-Fowlers and move his trunk. But since we don't have a semi-Fowler, then we would do the appropriate, like, moving back just to skip to the exercise itself. So he would be in decline, and then I'd probably be up here moving him, and I would have him try to move. So you work with me, really activate your extensors and come over this way. Push, 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 push. Good, and maybe stretch him a little bit, come over. So that rocking also will help to relax that rhythmic movement will help relax the tone and rigidity as well.
Yeah, can you show me the rocking? Because you're right, the rocking helps. So just show me.
So, and you would have him do it too. Like I have him like.
Well, when you do the rocking, you do it passively. You're just rocking that. You're just rocking.
Okay, just simple rocking. Right. This way.
There you go.
This way.
Excellent.
Step with me, Jorge. Push, 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 push. Good. Push, 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 push. Yeah, you push him down and really giving us some feedback.
Very nice. Very well.
We should do the balance.
So we're gonna do some breathing exercises. Today I'm gonna teach George how to do autogenic drainage. Jorge. So Jorge, like I heard that you have a history of pneumonia and a respiratory infection. So what we're gonna mobilize the secretions in your lungs. Okay. So what I want you to, what we're gonna do is a technique called autogenic drainage, and what it consists is like doing 3 slices of breath. We're gonna do small breaths first, medium breaths after, and big breaths at the end. Okay. So what I want you to do is to put one hand on your chest, on the top part of your chest, and I want you to make a little small breath. Take a little small breath and imagine that you're pushing out this hand away from your body. Okay? Okay? Show me how you do it. feel the urge to cough, I'm gonna ask you to suppress it. We're gonna cough big at the end, okay? Alright, so you're doing great. So you did that 5 times. We're gonna move to the medium breaths. So I want you to inhale a little bit more. We're gonna target the middle part of your lungs. So I want you to take a little deeper breath, but not all the way, okay? Alright, that's good. Okay, just hold at the top for about 2 seconds. Very good. So we're gonna do that like about 5 times. Again, if you feel like coughing, don't do it. And lastly, we're gonna put our hands around your ribs. Is that right? Okay. Good, right here. Okay, so you can let this hand rest. So we're gonna take the deepest breath you can, and we're gonna pretend that you're pushing your left hand away from your body. Okay. Okay. You see that? So you're gonna hold at the top 2 seconds, and you're gonna release. We're gonna do that 5 times, and at the end, when we're doing all the reps, then we're gonna do a big cough, and also if he needs to basically get rid of the secretions like the spit or cough secretions, he's ready for that.
Okay, good. You did it beautiful. Andrea, I encourage you guys to do it with that knowledge and then try to use words, like what words would you use if your patient doesn't understand, right?
Oh, okay.
Because, it's true, you did it correctly, you did it beautifully. They wouldn't understand suppress, right? They wouldn't understand hold it sometimes, right? And I like the fact that you said here, so use your visuals or touch. Remember, they need more concrete rather than abstract thinking. So by saying you should feel the air here, you should feel it here, or you should feel it here, gives them where more or less they're thinking about, right? So, because it is hard. This type of breathing pattern is a little hard. So you did a beautiful job. But now you have to kind of teach somebody who doesn't understand it.
Not cooperating.
Yeah, or isn't understanding what you're trying to say. So that's where it's even more challenging. So you think about what kind of language words can I use instead, right? But it was a good job. Excellent. Okay.
Oh, improve balance.
Okay.
So for this one, we're working for improving overall balance. So she can do it sitting down or probably maybe in a wheelchair, just such as the back support.
Also, I highly encourage that if you're working with balance, remember the feet, you cannot work on balance if the feet are in a wheelchair. Okay? If I'm working on balance and I'm like this, I'm not really working on balance. Do you understand? In order to work on balance, my feet have to be on the ground. I should not have a round. I shouldn't have anything. If I need support, the therapist needs to be there. If you're doing everything, if I have full support, I'm not working on balance, I'm just chilling. Okay? So you should be at the edge. If you're at the chair, you should be at the edge. That's it. Now you're working on balance.
So what we're gonna do here to improve the balance is, so we just support you. With your right hand, you're gonna reach across towards your walker, and then just pull it towards you. Now with the neck, because I just reset it every time. With the left, same thing. And then this is just, again, to improve balance, and then this will help her with daily activities like reaching for the walker whenever she needs it to try to get up.
So I love the activities. What do you guys think? Could George facilitate this a little bit more? Okay, so how could you facilitate it? I mean, take a minute and say to yourself, how could I help the person who's not able to move?
Passively do.
All right, passively do
Okay,
it.
so we're gonna reach for the left, just like that. Okay, so just reach, let it grab, and then just pull back.
Okay, so where are your points of control? Not too bad. And then what about the elbow? That's it, nice.
See
Excellent.
that? You can relax. Same thing with the right.
Beautiful.
I guess I'll just do it one arm at a time. This one.
I think
it's
it
just the-
is
it's just
definitely,
the
yeah,
back.
definitely 1 arm at a time is
Yeah.
definitely the way to go. Now, let's say though that, remember their trunk is very stiff. Could you also facilitate that? Like, could you really encourage that as well? So how would you also use your own hands to assist? So instead of putting them at your hands on the scapula, where can it go?
Let's do this.
Okay. Good hand position, but on the same side. Yeah.
So it's okay.
Yeah. So, what area of the back typically rotates? Is it the upper, middle, or lumbar? Your thoracic is the one that typically rotates. When the thoracic spine is very tight, that's when people use their lumbar spine, and that's why they have a lot of herniated discs. Typically, it's your thoracic. So you want to kind of here. See that? Here. You feel that, Diana? See that? Let me see how my body moves.
Oh, this is angle.
Okay. Now try it. That's it. You see that? A lot better rotation, right? So now you have exactly what you wanted and you envisioned, that ideomotor, right? I envisioned this beautiful stuff. How can I create it? Excellent, okay? Beautiful. I like the activity. It does add that rotation, reaching for the walker, right? And then you can, with Parkinson's patients, if you don't have music, you can use metronome. Faster, slower. Okay, that kind of keeps pace also. Okay, excellent, very nice.